I'd like to talk to you about mastectomy surgery. The reason I started this project was in 2007 when I was doing some training. I found that in our city, London, Ontario, mastectomy is day surgery. In fact, they're now trialing double mastectomy as day surgery. So whether you have day surgery, if you have mastectomy or lumpectomy, you will go home the same day. And you will go home having had a mastectomy with a drain, or if you have surgery under the armpit, drains. They actually come in the form of a V, and the drain will be in place for approximately 7 to 10 days. Remember when I talked about local versus systemic treatment? With local treatment first, it will be on average 7 to 10 days. If, however, you're having systemic treatment first, like chemotherapy, sometimes the drain can be in place for up to 3 weeks. That's quite normal. The drain will not pull out. It's not as if you'll roll over in bed and it'll pull out and spray blood all over the ceiling. It will stay in place. And it's painless, and you'll just wear it underneath your clothing. I actually have designed a simple drain bag that I can show you that you can wear underneath your clothing. And you can just wrap the drain device, we call that a hemovac, in place. And it is drained every day. They'll actually show you or a loved one how to do it. The nursing used to do it every day, but here they teach you how to do it. And then you need to monitor how much fluid is drained every day. And what happens is the hemovac has these little springs in it, and it creates a gentle suction. So when it gets full, it needs to be drained. And when there is less than 30 cc's or 1 ounce of drain fluid over 24 to 48 hours, a visiting nurse will come and remove the drain. And that feels strange, but is not painful. Although I do suggest maybe taking something like an extra strength Tylenol 20 minutes to an hour before you have it done. And then that little hole, you'll put a Band-Aid on, and it will close up overnight. Now after the mastectomy, after the drain is out, you may still get a little bit of fluid that will build up under the skin. It's called a seroma. And sometimes it can get a little large. It'll feel like you have a bag of milk moving around in there. We don't normally do anything about that unless it's hot, red, or you have a fever. So the fluid will reabsorb into your body gradually, and then you'll be left with a flat surface where the breast was. And that's mastectomy surgery.